Now, every industry, of course, has had to adapt massively as a result of the COVID-19 pandemic, but no industry more so than the healthcare sector. And a lot of my work over the last few months has been looking at what are the key trends that will define the months and years that follow this crisis as a result of what we've seen in the COVID pandemic. And we'll look at just three very quick trends that will define the future of healthcare. And the first one is simply this: we're going to see a rapid decentralization of healthcare. And we've seen this play out for a number of years now, but because of COVID, this will accelerate significantly. Now, just before COVID was launched, in fact, only 5 or 6 months before COVID occurred or came onto the scene, we saw the NHS in the UK actually launch their own Alexa skill, which allowed people to ask Alexa, the Amazon smart speaker at home, for any range of different medical questions for advice or information, and Alexa would search all of the NHS's medical database and come back with, if not a diagnosis, some clear ideas of the sort of things that the person might be looking for or maybe need to get attention for. And what's great about this was the idea was this would be a first port of call for those who wanted medical information rather than going to Dr. Google or going to a local emergency room. This was absolutely genius, because when COVID hit, suddenly there were a whole lot of resources available to people that didn't require them to come to a clinic or a hospital to get service. Bearing in mind, of course, that coming to a hospital was very dangerous, particularly in the beginning of the first wave of COVID in the UK. Now, part of this is generational. You've got a younger generation who are very, very comfortable with using this technology in order to gain information. For instance, check out the fact that 43% of millennials have made a voice device purchase in the last 12 months. They're very, very comfortable with this technology, and it's important for health providers to be meeting younger generations where they are at, and many of these smart speaker platforms is where they need to begin, and I would applaud the NHS for doing just that. But of course, it's more than just using smart speakers to push information out to potential patients. There's some functional changes as well that will be driving decentralization. For instance, the use of drone technology will be significant. We saw in the middle of the COVID pandemic, the FAA in the US actually approve Amazon's drone delivery program. And why that is significant for the health spaces, we saw within a few weeks a flurry of activity for healthcare providers looking to use the same sort of technology for things like delivery of vaccines, delivery of personal protective equipment, but also for organ donations. In fact, we saw a test 3 weeks after the FAA approval for Amazon for this very technology to begin to be used. Now, it's more than just drones. We saw some other great examples of how do we use this technology to make remote healthcare less of a barrier and a challenge. For instance, the Great North Air Ambulance Service in the UK actually began testing these jetpacks to get paramedics to people who are in remote or rugged locations. I don't know how comfortable you'd feel driving or wearing one of these, but this is a sort of technology that's on the way. Now, at a much smaller scale, not as dramatic perhaps as a jetpack like this, has been the use of augmented and virtual reality. This is one to watch. In fact, in the middle of the COVID pandemic, we actually saw remote surgeries being done using virtual reality because it reduced the risk of cross-contamination within hospitals. And this is something we will see front and center over the next few years, which would be great for people living in remote areas who can be operated on by a robotic surgeon in a local context, that may be operated by a surgeon who's actually in one of the major cities. Number two, the second thing we're going to see is the personalization of healthcare in some exciting and some significant ways. In fact, some of these interesting examples we're seeing coming online are often what's called liquid biopsies, where we're actually able to do genetic or DNA sequencing, particularly to test for a range of cancers, without actually doing any more than taking a simple blood test. And there are a couple of examples. Grail is just one of them that are really at the cutting edge of this technology. The other interesting thing about personalization of healthcare is at the minute scale. For instance, the impact of nanotechnology. We've seen some amazing examples at the nano level of tiny microscopic surgical robots performing surgeries. In fact, this is an example here of one that was a microscopic robot that was actually carried a payload of thrombin, the blood clotting agent. It's injected into the bloodstream. These tiny microscopic robots float around the bloodstream, identify a tumour, latch onto it, inject the thrombin, cutting off the blood supply of the tumour. It begins to shrink within 48 hours. This is a radically different approach, a targeted therapeutic approach that is incredibly personalised to the patient, and again will become increasingly the norm. Number three, the third trend that will shape the future of healthcare is digitization. We are seeing the combination of digital technology and therapeutics in some amazing ways. In fact, in many ways, we're becoming almost cyborgs as human beings. The technology we're wearing on our wrists is a big part of this. Smartwatches are the next frontier. In fact, we saw just a few months ago the launch of Lumi Health, which is a partnership between Apple and the Ministry of Health in Singapore, where people who are using Apple smartwatches can actually have things like their heart rate, their nutrition, their sleep patterns monitored, and if they reach certain health targets, they actually get cash rewards, incentivized. This is a gamified approach to shifting healthcare in the community by using the technology that people are already comfortable with using. Interestingly too, we're seeing some examples that might be a bit creepy to some of you. I read about this one only a few weeks ago called Nightwear, which is a smartwatch app that if you're having a nightmare, it will sense that your heart rate and breathing has been elevated. It'll actually vibrate to wake you up from a nightmare, especially for post-traumatic stress disorder patients who may need this in case they've got dreams that are actually, in some cases, damaging to them mentally. This is also a key technology in the aged care space. For instance, we've got an example here of a technology deployment where this actually measures the walking patterns, the sleeping patterns, the nutrition of older people so we can monitor their health a whole lot more closely. Now, there is little doubt that this technology will be game-changing, not just for the elderly, but for all of us over the next few years. And at the core of it is going to be data. Data is going to be the most important commodity in every area of healthcare. And the reality is some of these things coming online are confronting. They're outside the box in terms of what we're used to and comfortable with, but the reality is they're coming. How do we make sure we're using them to make sure we're getting the best patient outcomes? I love this insight here from the great Chinese philosopher Lao Tzu. He said, resisting change is like trying to hold your breath. Even if you are successful, it's not going to end well. What we cannot do right now is hold our breath. Try and resist the changes that are coming. In the interest of patient outcomes and safety, we've got to be one step ahead, looking for the next things that will be the game changers in terms of healthcare outcomes, not just for the system, but for the patients themselves.